So thanks a lot for the invitation to speak on this panel. I'm delighted to be here, and I'm going to combine remarks, I think, in terms of where I'm coming from on my presentation. I'm going to talk a little bit about the research that we've done, or the consultations we've done around core competencies, or what we refer to as graduate attributes for health services and policy research trainees or graduates. And I'm also going to talk a little bit about the role that I think Casper could play in advancing the training and promotion of health services and policy research competency, both amongst our graduates and in the field. So to begin with, I want to talk about this research project that we did on core competencies. The intention of our project was to try to drill down and figure out what it is that is truly core to those people who see themselves as being the producers or users of health services and policy research, in terms of the attributes that they have to have in order to be successful in their career. We weren't looking for all of the minutiae in terms of the variety of health services and policy research attributes or competencies that might be out there, but what are the cross-cutting themes that would unite the field? The consultation actually revealed very quickly one dominant theme, or actually a couple of them. But one of them was that our field, or our community, is very much one of applied scholarship or evidence in practice. I make the analogy to engineering, and hence the metaphor here of this bridge, where the intent is actually to do something with knowledge, not just to produce knowledge for its own sake. And that is a unifying characteristic of people on both sides of the research production, research use equation. The other metaphor in this slide is this notion that our community of health services and policy research users and producers is very much a bridge-building community. In fact, the spirit of the programs that Alba talked about was one of bringing two communities together and working together towards evidence-informed health policy. And I think that is an important metaphor, and it's an important lesson in terms of thinking about how we train and how we continue to engage people in our field in what we would consider a lifelong learning. So playing a little bit with that building metaphor, this is the framework that we came up for graduate level attributes at a master's level. So when a graduate student enters and finishes a master's program related to our field, what would we hope that they have attained? And this is a metaphor as well as a pyramid. So at the base of the pyramid, and in some sense perhaps as qualification for entry into the field, there are a few characteristics that we are looking for and hoping to develop in our students and in ourselves. And these are characteristics that we said were the characteristics of a lifelong learner. Someone who's conversant in a variety of different areas and disciplines, able to communicate ideas within their own field, but also across fields. We heard overwhelmingly the ability to write with power is critically important to our field. I'm not entirely sure our training programs do a great job on that quite yet, but that's something to be developed. But a variety of skill sets that are probably important, not just in health services and policy research, but in other fields as well. And again, we characterize these as the characteristics of a lifelong learner. You can actually read the essay that this is about in Healthcare Policy, the journal that Alba referred to, and I just tweeted the link to it a few minutes ago, so it's out there live. The next layer of competency, or layer of graduate attributes that we uncovered in our consultation process, was a breadth and depth of knowledge. And this is somewhat important in an inherently interdisciplinary field like this, is that you need to be reasonably conversant in knowledge base around a variety of fields, whether it's in my field such as economics, or if it's a field such as health management, information technology, maybe some health sciences. There's a variety of disciplines and fields that you might draw from, political science, etc., that students need to be exposed to and need to have an understanding of, including, for instance, a variety of research methodologies. One of the things that came up in our consultations was the belief that even at the master's level, most students should be exposed to both quantitative and qualitative research methods in this field. Now, taking it to the highest level in terms of what really separates the field of health services and policy research from other, perhaps allied fields, thinking in terms of things like even epidemiology and public health and others, is is the notion that ours is applied knowledge to inform and to promote evidence-informed health system change, and ultimately to create a better performing health systems, more equitable, more efficient, higher quality. And this requires a level of health system insight and acumen, which is arguably, for the most part, the kind of thing that gets developed through practicum and through training opportunities where students actually spend time in decision-making environments and actually learn the machinery of the system that they are likely to become practitioners in, as oftentimes graduates of our programs are not actually academics. They become graduates, particularly at the master's level, who move on into non-academic settings, but they're critically important in terms of advancing the health system. Now, we recognize that in the first go of this, when we did our first consultation, which is now about 3 years ago, we were focusing on master's level core competencies. And so we admittedly had to ignore a huge amount of diversity in our field. There's a variety of subspecialties, there's a variety of disciplines from which people enter into this field of practice. In fact, one of the things that we recognized in our consultations was that a vast majority of what we called the policy elite, or the decision-making elite that we interviewed for these competency development processes, said that they actually never received any training in health services and policy research, in part because it didn't exist at the time that they were training. But often it also reflected the reality of a career in government or in a health system or in other sectors of the economy where people ebb and flow and come into various areas over time. And I think that the area of health system management and health system decision-making, or even related research, is one that people tend to come into and then see, think on a set of shared values, a real sense of meaning, and it tends to attract people to stick around a while as they solve the problems. And I hope that's not just because this is like Groundhog Day every day, in the sense that the problems never go away. Another thing that we recognize, and actually it's a problem for us who are responsible for curriculum development. I spent the last 4 years as chair of a curriculum committee for a School of Population and Public Health at UBC, and it's a challenge trying to navigate both the university administration and the autonomy, the incredible autonomy of your professoriate, and the demands of what would be an ideal training program. In reality, students in a master's level probably have 2 years in your program and may only have about 18 months of actual classwork, before which you set them off on doing a thesis or maybe doing a practicum in a decision-making environment. So we have to recognize that there are constraints to what can be achieved and how much training you can actually do during the graduate training program. And this is where I think that we as a community have to be thinking more about lifelong learning amongst our profession, advancing tools and techniques for helping all of us become better researchers. I think there's a variety of things that can be done on that front. The other note, and this is a popular graphic for these days on the internet, what do we want? Evidence-based change. When do we want it? After peer review. I think that there is a danger that actually our training programs, or our universities in particular, not necessarily the training programs, but our departments and universities, are looking to attract and probably enroll more PhD students than perhaps is optimum, both for the system that it serves, but also for the candidates entered into it. I know my university just accepted more PhD students than master's students this year, and I do wonder whether or not the career prospects of those PhD students after they graduate justify the additional time and cost of the educational program. I do think we need to be mindful that the incentives that we have in our system create the outcomes that they incent. And just like fee-for-service creates an outcome around perhaps a high-volume medical practice, the way we reward universities for enrolling students actually tends to create an incentive to have candidates at the PhD level who are at your university paying your tuition, but not necessarily in all of your classes. And I think that, that's a cautionary note to myself as a university instructor and someone who was involved in university administration, and to all of us in the university system, that we've got to be careful that we're not sort of providing too many spots, so to speak, in our PhD programs, and thinking more about graduate level programs that are tighter, more flexible, and actually probably aimed at trying to create actors who are actors of change in our system, probably not necessarily the academics. So what could Casper do? I think there's a few things that Casper could do to help support the community. One of the things that I think Casper could do is to continue to the work that we started at UBC, which is to consult and to think about what graduate attributes for the field are. We did a one-time project on master's level core competencies. We haven't had the time or resources yet to take that to the next level and think about how would you do subspecialties, how would you do a PhD level competency. And I think one of the pet interests of mine is, what would we define as the canon for health services and policy research in Canada? That is, what is the essential readings that we should all probably read? And is there a volume, perhaps, that could be put together of papers that are exemplary in terms of both their contribution to the way we think about policy problems and also their contributions to the way we translate knowledge into research? I think Casper could possibly take a lead on compiling that essential reading list. I think there's another thing that Casper could do, and I would certainly benefit from it, and that is to help us who are instructors become better instructors, help those of us who teach be better teachers. We tend to teach the same way all the time. We line up certain drills and we go through certain motions in terms of our courses, and I think that the scholarship of teaching and learning could be advanced in our community. As I say, I confess this as a sinner in the sense that my pedagogy is typically, I think, frankly, out of date and needs to be updated. And I think Casper could facilitate workshops and training sessions amongst our community to advance best practices in teaching. And I think that that's something that would be a real value to us. I also think it could do something as simple as helping those who teach courses in health services and health policy to share their syllabus, their syllabi, and help co-develop each other's courses in a way that is fostering collaboration among what would be otherwise competitive programs. The other thing I think that Casper could do is, and I'm glad to see that the student working group is taking the lead on this actually amongst our community, is to do more evaluation of whether or not the demand meets the supply in our community. I think that what the students are working on right now is critical, and I thank them and IHSPR for supporting their work in this, and CHSRF as well. This is critically important, figuring out what the demand is and what the market is for our graduates. The other thing that I think is important is, I say this realizing that my class might get a failing grade. It would be really nice if someone took a project in this country where they went from university to university and actually assessed the training programs against some reasonable metric about what would be a quality program and actually gave us grades and assigned us, a report card, so to speak, about our training programs. Not as a national strategy, but each program on its own. You do a huge service to students, and I think you'd create a whole lot of incentive for those of us who teach to change the way we practice. So with that last rather provocative comment, I will end there, and thank you for your attention.